This project, the Nurse Hodge project, really was the genesis of it really was from our mother's vision and her passion to see prenatal care done in a way that I think far too often in third world countries or developing countries, prenatal care is something that does not have the attention that it deserves. And knowing that, St. Kitts is, I think, what we can consider to be a progressive country by all standards, I think it is quite fitting that such a program is put in place to ensure that, prenatal care is something that is seen as very important and highlighted, and this program only serves to incentivize patients to come in and seek the prenatal care that they so need. Now, you will hear about this more as in the second part of the agenda. Rosie will just shed a little more light on the details of the program.
Well, on behalf of the staff and clients of the Old Road Health Center and by extension the Ministry of Health, I am grateful and I'm also commending the family of Nurse Hodge for this very important and timely initiative of fostering the care of antenatals and postnatals of this area, which is from Trinity to Halfway Tree. This project is being launched today through the Nurse Hodge Children of the Caribbean Foundation, and it is most welcome. Nurse Hodge, I learned, had a deep passion for maternal and child health program, which include the care of the pregnant woman, care after delivery, family planning, and birth control, and vaccination of children against vaccine-preventable diseases. This project, I'm very certain, would be very beneficial in that it will be an encouragement for pregnant women in this area to seek the service more readily here. It will help to reduce the risk of maternal and infant mortality and morbidity among the populace and the decrease in pregnancy through family planning, thus enhancing the program. Again, I say thank you.
Thank you so much for coming out in support of the Nurse Hodge project. And I'm very briefly going to tell you what the project is about. I think Tommy did an excellent job explaining the project, and I'm going to tell you how it works. So as an incentive to get mothers, expecting mothers out to antenatal clinic and also to postnatal clinic, we have came up with the idea of giving points every time a patient attends clinic. So you're pregnant, you come to clinic, you're awarded points. Now, after you've had the baby, you can cash those points in for brand new products, cases of Pampers, baby bottle, Vaseline intensive care, Vaseline, the petroleum jelly. What else do we have? Clothing, brand new baby's clothes by Carter's, thermometers, and several other products. So essentially you attend antenatal clinic, you get points, you cash those points in for the rewards at the end of, after you've had the baby. It's that simple, easy breezy, so come out to antenatal clinic. All right.
I recall as a youngster, Nurse Ruth Hodge, and I know that she worked in this area for most of her career in St. Kitts and Nevis. And I know that the kids have an affinity to this area because they came here and used to go all up by the Carabel Boutique and enjoy themselves. And so there's somewhat of an attachment to this area of those kids, Ruth and Sherry, and of course, well, I don't remember if we were running around that time.
I was.
But certainly they have an attachment to this area. So when I was called yesterday morning, I said, listen, why don't you join us in a presentation to the health center in Old Road? I readily accepted. I think it is important that people who get the opportunity to travel and to increase in knowledge and understanding, and who themselves have raised themselves up by their own bootstraps, to always give back to the community which helped to nurture them. And this community has nurtured this family, and so this is one of the reasons why I'm so glad to be part of this ceremony this morning. The Ministry of Health is pleased that individuals like you, Sherry, Ruth, and Anthony, and Tommy, that you have chosen to give back to this community and want to encourage others who are out there in the diaspora and even here in the Federation of St. Kitts and Nevis, who are in a much better position to give back to the community that has helped to mold you. I therefore want to encourage all the mothers and fathers too to ensure that the services that is being offered here by this clinic and the gift being presented by this wonderful foundation as a result of Ruth, you will take advantage of it and of course gain your points, as I understand it, gain your points before your baby is born, so that after that baby is born, you can benefit from the gifts, valuable gifts that have been donated to this institution. I want to encourage you to see where in the country that your support is needed, and do offer them the support as well. I want to, on behalf of the ministry, thank you for the wonderful gesture, and to encourage you, to encourage others in the diaspora to do the same. On behalf of the ministry, therefore, to you, Sherry, Ruth, and Tommy. I don't know why I keep thinking Tommy. I keep saying Anthony. Let me thank you. I see, Mr. Pierce, I see your mother here on your right. Good to have you. I trust that, I know that the Hodge family has been very close over the years, and I'm glad to see that you're all here to give support to the children as they carry out this task that their mother wanted them to pursue. Thank you again.
Let me first of all say I'm very delighted to be here this morning. I'm going to take the order of protocol as established before me, but I cannot just adopt the order of protocol just like that. I have to mention a few special people, and it is only for that reason. And one, the master of ceremonies, Tommy, Sherry, Rosie, and Ruth Hodge's two sisters, Sheila and Yvonne. I must mention them. And by extension, Dr. Cameron Wilkerson. And by extension, the PS of Health, all who are family related. And let me say to you this morning, whether or not this occasion was in this constituency, which I have the honor and the privilege to lead, I would have been wherever it was. Because my relationship with the Hodges and the Skerritts, I think, go back beyond 3 decades. That's not to say how old I am, but it goes back 3 decades. But I think this morning is a wonderful occasion because so often we achieve much in life, but never seem to give back. And I think this is a wonderful occasion by the Hodges to give back something to not only this community in particular, but I understand throughout the island in general. But I think you started it here because I remember many years ago, we would see Nurse Hodge, as I called her then, walking up and down this district, dedicated, committed to not only this community in terms of its health care, but the entire health system in the Federation of St. Kitts and Nevis. She was a nurse par excellence. And I think many of the nurses around here could take a page out of her book because she was very, very, very dedicated. And I believe you would carry on that distinction and dedication that she epitomized back then. And to those who would be the recipients of what is there to be offered, and I see some in the very second row, and I mean those who are in the process of bearing young ones. I think it's an opportunity that you need to seize, take hold of, to ensure that your children or child to come gets the benefit of the best available care and attention. And I just want to end by saying that this facility here, the Old Road Health Center, looks to be in spanking condition, unlike many around. And I hope and trust we care it, take good care of it, and keep it in the pristine condition that it is in at the moment. Because so often we get things which come by way of grants or in this form, and we misuse it. And I want to tell you that the government's resources are small. We take what we have and we work it carefully, but we want to call on the community to take care of the gifts and the buildings and whatever resources the government has for posterity. Because if we don't care them, we will have to make sure that we build others, which is a waste of resources. But I think this morning, again, is a wonderful opportunity, and I want to say thank you to the Hodges and Nurse Ruth Hodge Children. I think it's a fantastic idea, and kudos to you. And I think the entire Federation of St. Kitts and Nevis ought to be proud, and we thank you. And I thank you especially.
I remember it like yesterday. My mother driving down, and during the summer vacation, she would drive down with my sister, my brother, and I. And we'd spend the entire day here, and you'd think, what would 3 young children do with a day in Old Road? There was plenty. We would walk on the coastline. We would climb mango trees, the best rosy cheek mangoes. We would, yes, my sister, we would walk up to the Carabel Boutique. We would, believe it or not, when the doctor came down to run his clinics, we would assist the physician, whoever it was. Usually it was my Uncle Mac, but we would be happy, I would be happy to help. These are memories, these are indelible memories that we will have forever. And I know while the body cannot live on, I think this is the only way one can achieve immortality. And I think in her entire lifetime, my mother worked so that she will live on forever. Everyone who knows my mother knows that she will never be forgotten. There is always a lesson. I started a few years ago, I started an Evernote document, Gems from My Mother. And there's so many of them. I use them on my children. I hope they will use them on their children.
Visit The SKNIS on YouTube to watch informative, exciting, and thought-provoking programs such as Working for You, Current Speeches, SKNIS exclusives, and much more. Hit the subscribe button to be alerted when a new video is uploaded. What are you waiting for? Head to the SKNIS and start exploring.